So what you see in front of you is exactly what you would see if you are an IBIS member. But keep in mind, this entire program, if you are to join, will be completely customized to your health needs. So what I might demonstrate today isn't necessarily applicable to you as an individual, but I just want to capture the breadth of what the system has to offer. And by the time you received one in your hands, it would have all of your medication loaded in. It would have your specific vital monitoring tasks loaded in, and all the appointments and therapies and health goals that you are trying to accomplish. I want to reinforce that this program is all dictated by you, the user, right? It is at your discretion on any day to report to us exactly what you want. We might make recommendations for what we think is the best care plan for you to follow. And that care plan is really created in collaboration with your primary care physician, factors in all of their goals and their inputs and what they would like to see you do in the home setting. But at the end, you're clicking the buttons on your tablet in your home. And on any day, you might click something you want to tell us. You might ignore something you don't want to tell us. Of course, we advocate for total transparency, but this is your experience and this is your healthcare data and this is your information. So what you see at the bottom of your screen is a series of icons that form the care plan for my demo account, Mike. Some of those to look familiar to you, like a little pill bottle for medications, or a cartoony man with some weights in his hands, or an oxygen saturation meter there on the far right, the device that measures our pulse and our oxygen level. And I'll just click through a few. It's all touchscreen, very simple to use. We provide these reminders and kind of guidance on a daily basis, and our members will, in return, interact with the icons that they see. They will report different elements of their health status. For specifically the vital monitoring components of the program, like blood pressure or oxygen saturation or weight, we will provide you the vital monitoring devices to be able to do that. We can provide them as Bluetooth enabled so that the information could directly be communicated to the tablet, or we can provide them not connected that manner. So you can take the vital, look at it, think about it, reflect on what you did yesterday or earlier today that might have led you to that vital. And a primary component of the IBIS experience is education about yourself, your diseases, its empowerment in your ability to manage the moments in which you start to get concerned that something might be going wrong. So I'm going to open a good morning icon. We always like to start our day off with a positive quote to get us on the right foot. Who doesn't love Dr. Seuss? The more that you read, the more things you will know. The more that you learn, the more places you'll go. And in a manner of interacting with this icon, I will just select Good Morning IBIS to let us know that we've gotten started with our day. And you'll be able to see reflected on the bottom of that care plan that the Good Morning icon is now indicating as done. And this is very valuable to you as the user because it also helps you keep track of, hey, what have I done today? Did I take my morning medication when a few hours later we might have forgotten whether we did or not? Or, hey, did I do my exercises? How well am I on track for my health goals as it relates to my chronic diseases? Now, good morning is just something simple that we think everyone should start their day off with. But of course, after we wake up, one of the first things that many of our members have to do is take some medication. So I'm going to open the icon indicated with the 7:10 a.m. time slot right after good morning. Now, one of the very impressive values and features of the IBIS tablet is that we actually go through the hard work to coordinate with your pharmacy to collect the NDC code, which is a specific number associated with the manufacturer of the medication that you take, such that we are able to display an actual image of the pill that you take in the home. And our medication adherence, when we added this feature, it went up incredibly because I don't know what a lansoprazole is, but I know what my tiny pink and black capsule is, right? And that's just a way that we try to simplify kind of the complexity of healthcare naturally and make sure that you know exactly what the best course of action that you can take on any given day is. And we are your cheerleaders to make sure that you are able to do that. And we're your barrier breakers whenever you run into obstacles to be able to do that. You have a side effect associated with a medication, or you're just feeling a little down and don't have the motivation or the energy, or you want to do something dramatic to shake up, your living situation and what you want to do. We are here to help you get to the point where you feel comfortable, where you feel confident, and when you feel safe in your home, living with these chronic diseases via the connection that a device like our tablet can offer. So I
No, I
won't
think
go through every icon here at the bottom because I could go on for minutes, but I hope you get a sense of how you engage and interact with a device like Ibis. And I want to reinforce that all of this health information here is being received by a virtual care team that Ibis Health Services staffs. And this care team comprises of, member advocates, nurses, clinicians, nurse practitioners, MDs, pharmacists, mental health clinicians, pretty much everything that you might want in your healthcare experience, whether that's some therapy services or pharmacology review of medication plans, or just a consultation on a bruise or a rash that might have emerged over the next day. We are here for you to address those issues. We will coordinate all of your IBIS health data with your providers. That can be your primary care physician, can be your specialist, of course, only those to whom you consent us to share information with. But a primary component of our brand promise to you is that, hey, if we are all going to support you in the home, we just need to know one simple thing, and that's how you're doing. And this is the way for you to let everyone know how you're doing. The goods, the bads, the tough days, everything in between. And hopefully that experience to you allows you to follow your care plan more adherently, to more quickly accomplish your health goals, to feel calm and stable in the environment that everyone wants to be, and that's our home. So as I discussed, that virtual care team who is standing by underneath this tablet, and this is ultimately kind of what makes Sensio and Ibis special and unique, is an artificial intelligence engine that is sorting through all the data and generating the moments in which your health status starts to deviate based on the data that you've registered into your tablet. So Sean mentioned a very common instance is you wake up, let's role play here an example of an IBIS member who had COPD, lung disease, and they use a device to help with their breathing, whether that's CPAP or some oxygen. And they wake up one morning, and in their IBIS plan, as shown here on Mike, they have a little reminder to register their oxygen saturation. Now, if Mike, my demo account, were to come in, click open his oxygen saturation icon and report an oxygen, that's a typical value for him. And that's all customized and unique to the individual, right? Because what's usual for me might be different than what's usual for you. But let's say for Mike, he comes in and registered an oxygen of 98% and a pulse of 65. Beautiful, beautiful vitals. But one morning, for whatever reason, Mike, his oxygen saturation is quite lower than normal. Mike will engage this reminder and go ahead and input the value that he reads. I'm going to be a little dramatic for the purposes of demonstration, but let's say Mike found his oxygen saturation to be 89%, and his pulse was closer to 70. His heart rate has accelerated. Go ahead and hit accept into the device here on the tablet to register this vital data into the IBIS system. And as soon as I hit accept, Ibis is going to detect that, hey, Mike, this is quite unusual for you. Would you please just confirm that this is the vital that is displaying on your oximeter? Now, I won't call out any of our specific members, but it is frequent that we might switch up a number or two and we enter 89 when we meant 98, or we switch the pulse and the oxygen, and all those things are exactly why we just play this message to make sure and confirm that the data is correct. So I look at my finger, my device, say, yep, I promise Ibis. That's exactly the vital that I have at this moment in time. And instantaneously, you can see a little icon pop up on the top right. Immediate course of action happened with the Ibis care team, in which a nurse received that notification that said, hey, whoa, 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 Mike has entered a lower oxygen than normal. Let's go ahead and give him a call and check in, ask him some questions, just like you would have done if you took that low oxygen and you tried to call the doctor's office, speak with a nurse, ask you to walk through a few steps, maybe use an inhaler or a nebulizer, which is a really strong lung treatment. And we walk you through exactly what the best course of action is to remedy this lower oxygen value. We check in with you very frequently to make sure that it's working and that our recommended solution is making a positive effect. And if not, well then, unfortunately, but at least we know that this might be a little bit more serious of a situation than what we can handle at home. And ultimately, when we get concerned because of, our heart starts to flutter or we get a little short of breath, it's a very anxiety inducing experience, at least for myself personally. And that can almost compound the situation and make it even worse. And we will be there for you immediately when those things start to happen. So you don't have to worry about getting in touch with anyone. We will get in touch with you. You might say, hey, I just flipped the numbers, leave me alone. And that's all that we need to talk about. Or you might say, hey, I'm really, really worried. What should I do here to make sure that I get the care that I need and the right care by the right person at the right time. So our team is here on standby for all of these various deviations in health data that you might report through the device. That could be your pain, your mood, your shortness of breath, swelling in your legs that you wake up and you might be wondering, should I take an extra diuretic or not? All of those are just standard conversations that we have with our members on a daily basis. So I just want you to leave with the lasting message that all of this data, self-reported by yourself, is connected to licensed medical professionals who are here to help you in that immediate moment, to work with you, to resolve the issue, and to coordinate the data with the people that care for you. And that can be family, that can be doctors, specialists, like I mentioned. And that's how we make the whole ecosystem work. Keep everyone informed. Most importantly, keep yourself comfortable in the home and let all the medical professionals support you to give you the best care possible. But it all starts with knowing how you're doing. Now, lastly, Sean, I'll just cover, because it's on the screen and maybe your eyes have wandered. Of course, what good would a piece of technology be without some games? That little checkerboard icon on the bottom left. We have a rewards program for our users captured in that medal that you can see on the left bar. That reward is really a thank you to our members for putting in the hard work to take care of themselves every day. I know through personal experiences with some of my grandparents, it can be an arduous task, and our motivation fluctuates to take all of our medication, to go for that walk outside, to try to live the best day that we can. And ultimately, what you're looking at the bottom reminder plan is just your checklist for the day, right? What are the things that I need to do to take the best care of myself possible? And at Sensio and Ibis, we really believe that that ought to be a fundamental human right, just being able to take care of yourself and having the tools at your disposal, which is why we're so happy and grateful for Medicare and Unicare and Maya to pay for services like this so that you as the individual in the home don't have any undue cost to you, and you can have the resources to be able to take the best care of yourself possible. So I want to leave on that lasting message of gratitude for the opportunity to share all of this with you. Everyone's experience is unique, it's personal. And we hope that if you were to join the Ibis Health Program or experience some of your time here, you'll feel that a personal connection and that sense of comfort and independence in your home.